I am Joanne Lee with Healthy Places by Design, and I'm really pleased to welcome so many of you here today. I do want to acknowledge I have two colleagues that are joining me in this webinar space who will be supporting me and making sure that your experience is all that it can be as participants. Risa Wilkerson, our executive director, is with us, and she will help to facilitate the question and answer portion of today's webinar. Becky Snyderman is our project and events coordinator and is serving as our chat manager for this webinar, and she's also providing Zoom platform and logistical support. Before moving into today's topic, let's review some logistical items intended to create an atmosphere that supports group learning and engagement. The chat box is a space where we can share and learn with each other. Please use the chat box to add comments, reactions, as well as any links to related resources that you think could be helpful for others. Be sure that the setting in your chat box is to everyone. Unless you need one-on-one logistical support, in that case, then direct your chat to Becky Snyderman. Participant chats can be a great way to gauge how the webinar content is resonating. However, if you find the discussion in the chat to be distracting, know that you can close it and disable the chat notifications in your Zoom settings. Another Zoom menu item that I'd like to point out is the Q&A box. If you have a question for our guest presenters, please put them in the Q&A box, not the chat, so that we can more easily manage and address the questions. We do have time at the end of the webinar to address as many questions as we can during the time that we have, and Risa will be helping us to manage that. A note that we have made closed captions in English available in this webinar, so feel free to turn on that feature if it's helpful to you. This webinar is being recorded, so you will receive the recording and the slides from today's webinar. In fact, by joining us live today, you'll be among the first to receive the slides, as well as a resource guide with just a wealth of information, helpful guidance. You'll receive those materials before we disseminate them publicly and post them on our website. So a bit about Healthy Places by Design and why we've chosen to host these webinars. Our webinars are a component of our Socially Connected Communities Network, which builds and supports a movement to advance action that results in more socially connected and equitable communities. Our network has 4 components, and each one enables you to opt in based on individual and community needs. Our bi-monthly webinars are for learning and growing knowledge. We host network webinars in the odd months of the year. We'll share a schedule at the end of the webinar so you can mark your calendars and join us. We also offer discussion groups after each webinar to deepen the learning gained in the webinar. The discussion group sessions immediately follow each webinar for attendees to share and brainstorm with our guest presenters and with each other. We'll chat out a link to join today's discussion group at the end of the webinar, so be on the lookout for that. Socially connected communities is a key focus area of our organization, and Healthy Places by Design also produces resource guides and other essential resources on the topic and related topics to social connections. And you can access these resource guides and documents anytime on our webpage. Becky is chatting out the link so you can bookmark it in your browser now. And the 4th component of Healthy Places by Design's Socially Connected Communities Network are peer connection sessions. These sessions are tailored for networking across affinity areas, such as priority populations or specific implementation strategies. We're planning to host a peer connection session for community coalitions soon. So be on the lookout for more information about that session if it's of interest. And also contact us to let us know if you have ideas for future peer connection sessions that we can host. So we like to start with hearing a little bit about our audience. And so we're going to do a very quick poll. to hear from you. We'd like to meet you no matter where you are on your journey to create, expand, or sustain socially connected communities. So, to get a sense of where we all are in our socially connected communities journeys, please respond to the poll that Becky has launched. I see some of you have already gotten in there, which is great. And we'll give you just under a second to make sure everybody has a chance to respond to the poll. Be assured that we will not share, there's no identifying information on the poll. So all of the answers are grouped and it's anonymous. Great, we've got about 70% of you completing the poll. Wonderful. So I think, Becky, if we can just share the group results. So in case folks are curious, that would be great. Now, on to our exciting webinar topic, exploring the intersection of civic, social, and community health. All right. Thank you for your understanding with my mouse capabilities. Civic, social, and community health are more than interrelated. They mutually reinforce one another. Civic health is the degree to which and the ways in which community members participate in activities to strengthen well-being and interconnectedness, as well as the infrastructure that is present to provide accessible and equitable communities. As civic participation increases, so do the social networks, norms, and trust within a community. Civic participation encompasses a range of activities, both formal and informal, including voting, volunteering, and other community service, including things like environmental clubs and community gardening. Civic participation provides mutual benefits. There's a direct benefit to the community as a whole, as well as social, psychological, and health benefits to the individuals who participate. Today, we're so fortunate to have two thought leaders in the healthy communities field who will help us learn more about the intersections of civic, social, and community health. Anita Chandra is Vice President and Director of RAND Social Economic Wellbeing, and she's also a Senior Policy Researcher at the RAND Corporation. The division that Anita leads covers a range of topics at the intersection of social and economic policy. As a researcher, Anita leads studies on health and health equity, civic well-being and community planning, disaster response and resilience, and more. Throughout her career, Anita has engaged government and non-governmental partners to employ cross-sector solutions to improve community well-being. Anita has conducted broad-scale health and environmental needs assessments to determine how to integrate equity and address the needs of historically underrepresented populations in human service systems. She earned her Doctor of Public Health degree in Population and Family Health Sciences from the Johns Hopkins Bloomberg School of Public Health. Michael Stevenson is a co-director at County Health Rankings and Roadmaps, or CHR&R, and Michael is a longtime friend to Healthy Places by Design. He most recently served as the Evidence and Policy Analyst Team Lead at CHR&R. This team's work includes What Works for Health, an online database that provides community leaders and policymakers with promising strategies to advance health and equity, which Michael will be sharing with us today. Prior to joining CHR&R, Michael was the Director of Health Strategy at the City of Milwaukee Health Department, where he led large-scale planning efforts, advised on public health policy, facilitated partnerships, and analyzed public health data. Michael holds a master's degree in public health from the University of Wisconsin, Milwaukee's Zilber College of Public Health, and a bachelor's degree from Wartburg College. Please join me in welcoming Michael and Anita. We'll launch our conversation with you, Michael. And CHR&R just covers a breadth of health topics that are so useful to community practitioners. Share with us why CHR&R has chosen to focus on civic health and why it's important for all of us working in the healthy community space to pay attention to civic health.
Yeah, thank you, Joanne. I appreciate the introduction, and it's truly an honor to be with you and Anita and the team today. So what I want to start with is that County Health Rankings and Roadmaps is really committed to broadening our view of both what shapes health and what shapes equity. So we all know that things like safe housing and access to nutritious foods, livable wages, and other things outside of a doctor's office influence how well and how long we live. But what are the policies, the laws, the traditions that determine those conditions? And who decides which places get adequate resources for people to thrive? We're asking ourselves these questions and really turning our attention towards the forces that shape those conditions. So, access to safe and affordable housing, good paying jobs, for example, they're all important to health. And what's really important to note is that they're shaped by power and structures. And these structural determinants of health show up in our laws and our policies, our beliefs, and our worldviews. So we've chosen to focus on civic health because the opportunities that we have to participate shape community conditions. Um, Also important to note is that civic health contributes to socially connected communities. At CHR&R, we are exploring two aspects of civic health: infrastructure and participation. And I want to unpack each of those terms a little bit further. So, civic infrastructure really provides us with spaces to meet, to make our voices heard, to engage in cultural activities, and to assure belonging. Infrastructure includes things that we all know. These are places that we all have been and go to frequently. So, things like schools, libraries, parks, even broadband internet can be considered civic infrastructure. Civic infrastructure also includes those policies and practices that create and cultivate environments where everyone can exchange ideas and solve problems together. So, civic infrastructure is one component of civic health. Another component is civic participation. So, this includes the ways that people engage in community life to improve conditions, whether that's through voting, which is something that we often think about, but it includes activities like advocacy and volunteering and mentoring. Supporting ways to participate is really foundational to building healthy, thriving, equitable, and socially connected communities. Before I move on, I think this is a really important note to make. So civic infrastructure, those places where people connect and share information, are essential to fueling participation.
Absolutely. In order for people to actually engage, they need those opportunities that are really influenced by policy systems and environments in a community. So, Michael, with this perspective about civic health in mind, what is the data telling us about the status of civic health and socially connected communities in our country?
Yeah, so each year, County Health Rankings and Roadmaps has an annual data release that offers a look at the health of nearly every county in the nation. And our annual data release also includes a national findings report. In this year's national findings report, we explored the structural barriers to health and equity by focusing in on civic health. And just to remind folks, civic health is the ways that we participate to make to make our voices heard. So we know that when we work together, we can improve health for everyone and have more socially connected communities. So in the next few slides, I'm going to walk through some of what we featured in this year's National Findings Report.
Perfect.
One other thing that I'll note before I jump into some of the findings is that folks can visit countyhealthrankings.org to read the full report. The report will also be shared in the webinar resource guide that Joanne mentioned at the top of the webinar, and will be shared after today's webinar. So one of the things that we looked at in this year's report is really just noting that healthy communities really depend on a culture where all people have the power to make change and have a say in the decisions that affect them. And people need to be informed about what is happening so they can take action. But what we know is that opportunities to be informed are not the same across the country. So one of the findings from this year's report is that among the healthiest counties in the US, so those are counties that are measured by length and quality of life, they tend to have better, well-resourced civic infrastructure. This includes things like better access to local news outlets, better access to broadband, and better access to public libraries. And they have more access compared to counties that are among the least healthy in the country. What we also know about these counties, these counties that are among the healthiest in the country, is that they often also benefit from social and economic opportunity. So these things are going hand in hand.
Mhm.
What's also important to note, and what we talk a lot about in the report, is that counties with well-resourced civic infrastructure also have higher rates of participation, such as voter turnout. So this really underscores that point that I started the webinar with, is that infrastructure really fuels participation. We see that in the data that we highlight in our national findings report.
Absolutely.
I want to expand a little bit on something that's really important to understand. So our data show that healthy communities tend to have better access to civic infrastructure. That's what I was talking about on the previous slide.
Mhm.
But our findings also show that these places tend to have better social and economic conditions and more participation. But why is that? So one of the things that we looked at this year was really looking at some of the historical context that underlies some of this data. And I want to offer an example to really help illustrate what this could look like. So many laws and policies that underlie under-resourced infrastructure have historical roots and are often still contested today. So one way that we can look at this is by looking at broadband internet, which is one form of infrastructure that's important to civic health. So the pattern of limited and unreliable broadband access across some communities can actually be traced back to redlining from the 1930s, when the Federal Housing Administration created maps that reinforce segregation by rating neighborhoods with Black or immigrant residents as risky real estate investments. This disinvestment continues today and has expanded to include digital redlining, which occurs when large network providers exclude lower income neighborhoods and communities from having broadband access. So consequences are really that these communities become more disconnected, and these communities are disproportionately made up of Black residents, which has an impact on the health and well-being of everyone that lives in those communities.
Yeah, thank you for highlighting that, Michael, because I think historically or traditionally we think about broadband deserts as being more rural places where it's less geographically dense, but we're hearing more and more about urban broadband deserts. Yeah.
Yeah, absolutely. So one other way that we see this relationship between civic health and health is through the map that's on this slide. So this map shows the green is life expectancy across US counties. It's also showing states, those that are highlighted with that kind of white outline, that are experiencing more structural barriers to civic health. And I'm going to unpack that for a second. So structural barriers include policies that actually make it more difficult to vote. So what we see in this map here is that regions of our country that create or reinforce structural barriers to civic health, so those discriminatory policies and practices, such as laws that create obstacles to vote, actually limit participation in civic life. Um, these structural barriers, as you can see in this map, are more common in regions with specific histories of structural racism and disinvestment. Rates of more structural barriers, so I'm going to pause there. Rates of voter turnout are actually lower among these counties in these states compared to other regions. And I think the take-home message here is that life expectancy is on average more than 3 years shorter in these counties compared to counties and states with fewer structural barriers. So our findings are really suggesting that there is a relationship between long-standing barriers to civic health and life expectancy. So we realize that correlation isn't causation, but as you'll read in the report and as I've kind of talked through briefly today, these repeated patterns that we see across time and place suggest that there's a meaningful relationship.
Mhm. And is there anything that would be significant to note about the geographic clustering?
Yeah, so we highlight a few different geographical patterns in the report. In particular here, where we focus on Appalachia and the Black Belt and the US-Mexico border. These
Mm.
are regions of the country that tend to have less civic infrastructure. These are also places that show up on this map here in terms of places that experience structural barriers to civic health.
Mhm. Thank you. Well, Michael, you've shared compelling reasons and data about the intersection of civic and social health and how it impacts community health. So I want to welcome Anita back to further explore the connection between civic health and socially connected communities. So, welcome back, Anita. And let's begin by having you share how RAND comes into this work around civic and social health.
Yeah, thanks for the opportunity to share and to collaborate with you and Michael on this topic. So RAND comes to it in a kind of a few different directions. Our mission is really focused on advancing research and analysis that's going to make our communities safer and more secure, more resilient, and help them thrive. And in my role at RAND, leading the Social and Economic Wellbeing Division, we're really focused on the intersection of people's well-being with their experience of place. And that's not just the natural and built environment, but the social, cultural, civic, and technological environment. And we know, as Michael just pointed out, that participation and connection matters to help people thrive. So we're very much focused on those features of communities that help individuals engage, participate, and flourish. The other piece that RAND comes to this work through is our work on the eroding use of facts and analysis in public discourse and democracy. And we came through this work through an initiative that we started many years ago called Countering Truth Decay.
Mm.
And in the context of that work, we've been exploring different aspects of how we measure civic infrastructure, how we invest in civic infrastructure, how we engage people politically, socially, and culturally. So we come through it also through our work on advancing democracy and this issue of truth decay.
I love that term. And
You like
you'll
the
talk a
term?
little bit more. Yes, you'll talk a little bit more about um, sort of mindsets, which I'm really excited about. Um, so let's hear more about the work related to that report. How is civic engagement linked to overall health, and how does it intersect with socially connected communities?
Yeah, I'll start with some broad overview and then get into some example studies. So broadly, we know that there's a connection between health, both physical and mental health, and people's ability to engage more in civic engagement. And certainly you saw that in Michael's findings. The story in terms of a research design have been mixed, though. Some studies show a longitudinal effect, meaning that early health problems make it difficult to engage civically. But we also know that poor health could be related to social isolation. That disconnection can make civic engagement difficult.
Mhm.
And so as we get into more of the detailed kind of analyses, we kind of outline some of the example studies on this slide, but I thought I would share just a few kind of bright spots and also areas where we see some of this correlational relationship, but also need more work longitudinally. While in this area, we can say we could use more studies to establish that relationship, we have some findings worthy of note. So for instance, there are some studies that have looked at the relationship between voting as one example of civic engagement and health condition. So in an older study, which was cross-sectional, looking at data from the behavior risk factor surveillance system, which many of you may be familiar with, authors looked at how voter turnout in the presence of one of five chronic conditions might vary. After adjusting for sociodemographic characteristics and some of the health-related confounding factors that we might expect, they actually found that individuals with cancer diagnosis were more likely to vote, while those with heart disease diagnosis were less likely to vote. So these kinds of associations differed by race and educational status. Notably in that study, Black respondents and those with lower education who also had cancer were more likely to vote than white participants and those with more education who also had cancer. The authors noted that maybe some of the differences in these kind of differences by disease state, if we're trying to really discern the health to voting relationship correlation, is that perhaps there's a social stigma associated with some diseases over others. And so there's more of a community that's created around cancer than with heart disease that sometimes is unfortunately linked to poor individual behavior and choices. The researchers don't know yet what really undergirded some of those analyses, but it gives you an example of some of the kind of individual level studies that are out there. Now, there are studies that have looked at voting and have ratcheted up to the community health indicators rather than just individual health. So, for instance, one team analyzed pooled cross-sectional time series data from across the continental US counties and looked at it over time. So really going back in time for about 20 years, which gives us a richness of data. to assess the relationship between measures of health equity and various measures of civic activism. So broader than just voting, but things like membership in civic clubs, working for a political party or a candidate, contributing to kind of local public television or radio stations, which we often see as a form of civic engagement, actively working with nonprofit organizations. And what they found that although increases in racial diversity were related to higher degrees of inequality and access to healthcare, higher levels of civic engagement and sort of other forms of like social capital as related to some of those items that I mentioned were related to lower levels of healthcare inequality. So there was a restorative or there is a promotive benefit of some of that civic engagement on closing the gap that we're so worried about in so many aspects of health inequality and inequity, particularly in levels of healthcare access. So the authors really concluded that some of those kinds of social capital efforts, the investment in getting people to engage, can counterbalance some of the effects of race on healthcare inequality, serving as a mitigating function, which is quite promising.
This is fascinating. Thank you so much for sharing this, Anita. And one thing I do want to call out is that I appreciate that some of the research is really getting pretty deep in identifying how people identify themselves, and having multiple sort of identities and how that influences civic health and overall health.
That's correct. Yeah. And we also know that people engage in so many different ways. So much of the preponderance of the research has been on voting. But there's so many ways that different populations and groups engage in terms of local action groups, grassroots organizations giving time to faith communities, social service organizations, and the like. And what we see on this slide is just a snapshot again of some of the key findings. There have been research showing that those who rate their health better tend to have higher trust in institutions, which speaks to this issue of truth decay that I mentioned earlier, and a sense of belonging. So once they have that higher trust in institutions and sense of belonging, then they also, perhaps not surprisingly, report higher levels of all forms of civic engagement. So you can see the relationship between these factors. Volunteering, which is certainly another form of engagement that many Americans engage in, shows some positive effects on health issues. But more is really needed to unpack the larger benefits of civic engagement beyond individual impacts on community well-being. So one of the areas that we talk a lot about in research and policy analysis is that we know that many of the factors that relate to a better perception of your own community's well-being, like connection and a sense of place, are associated with civic participation. We do need a little bit more kind of work to understand what kinds of investments are most critical for advancing improvements in community well-being.
Got it. Great. So, Anita, Michael noted earlier that inequities in civic infrastructure and opportunities have historical and systemic roots or underlying causes. And you've done related research on civic health and inequities. Please share a few highlights.
Sure. One of the things that we've been trying to understand since about 2015 through something that we call the National Survey of Health Attitudes is to try and understand where is American health mindset? Where are their attitudes about health and well-being and health equity and the existence of structural racism? But in that work, we've also tried to understand a little bit more about what people are reporting in terms of their engagement in civic activities, what that looks like fundamentally. And we just have released some of the survey findings from the most recent survey at the end of 2023, which highlights some important trends and gives us a sense of where communities are starting, where Americans actually are in terms of their level of civic engagement, and some differences by subgroup. So as we think about more formal engagement, like the ones that I talked about on the prior slides, like volunteering or getting involved in a civic meeting to address a community issue, we see actually relatively low numbers. Less than a fifth of the population is reporting that they are really engaged at that level to improve the health and well-being of those in their community. So it suggests that there's room for improvement, and this focus that we have today on social connection and civic infrastructure is merited. I will note that we have started to look at racial ethnic differences as noted here. And so, for example, in the question of did you attend a civic meeting to address a community issue, we see some notable differences with higher reporting of participation from Black African American populations, American Indian, Alaska Native populations, and with our Middle East, North African population, which we're now separately categorizing in surveys. Now, if we look at more informal engagement, which may be a place to actually start because people sometimes start there, we see actually something much more positive. People do report that they're supporting others in their community in myriad ways. And I just provide two examples here. Just shy of half of the survey respondents reported participating in a community-wide event, which is the start of connection and engagement. And then many more also reported helping a neighbor who was struggling. So in terms of building from those individual ties, we do have some places to start, even if the more formal engagement is less common amongst the American population.
I'm really glad that the research is starting to look at both, because even when we consider research or measures about civic engagement, if we only look at the formal ones, we're missing a lot of people who are not only contributing to their community, but getting benefits to themselves as well.
That's correct.
So
Now,
another
one
area,
thing
yeah, I
sorry.
just want to say another area of your work I wanted to point out that audience members will find intriguing relates to the mindsets that present challenges towards taking action to strengthen civic health. So I'm really excited to hear more from you about what these mindsets and challenges are.
Yeah, just like we asked about civic participation and engagement, we also asked about, so why aren't you, or what is preventing you from getting more engaged, more involved, whether it's advocacy on health and well-being topics or other social issues in the community, or any of the other areas that I mentioned on the previous slide. And what we found is, this is just a snapshot of 3 of the barriers, but I thought they were worthy of note, is that people are feeling like maybe they don't have all the information to know where to start. And that's immensely addressable with some of the actions and activities that many communities on the call are engaged in. We also know that about 45% didn't think that their involvement would actually make a difference in health and well-being in the community, which suggests that perhaps the way that community activities are designed doesn't necessarily give that feedback loop, or something else is going on in terms of trust and engagement. And you can see that with over a third of the population saying that they offered suggestions in the past, but felt it didn't go anywhere, which may then contribute to some of those earlier findings about not feeling like things are making a difference. So how we structure engagement and participation activities with feedback loops, follow through, continuous participation, accountability really matters in the context of civic participation.
Yeah, it's not a one-time thing. It's definitely about relationships and continued feedback loops, like you said. So in your work, are there a couple of examples that you can share to help our audience see how communities are already strengthening civic and social health?
Yeah, I'm happy to. So there's a couple areas that I and others work in quite a bit at RAND. One is in the area of community disaster resilience, and the other is civic well-being. I'll talk about community disaster resilience first. And one of the things that we learned through our work with communities, providing technical assistance and support, but also studying communities both in the US and nationally, is that when you look at communities side by side, regardless of socio-demographic characteristics, resource level, and the like, which certainly does matter in disaster response and recovery, communities that have strong ties between individuals, neighbors to neighbors, have a sense of volunteering, organizations that are ready to respond, and have strong ties between individuals and organizations tend to be more resilient, able to lessen the recovery time after a disaster. And unfortunately, with climate change and other crises, we're seeing more and more of that. And so we know that investment in these kinds of connections, investment in individuals being able to connect with at least one organization in the community matters. And what you see on the right are some snapshots from some of the projects that we did in Washington, D.C. and Los Angeles County, and the tag being, in an emergency, strong communities can be the key to survival. So this is really critical, not only because it matters for political participation, civic engagement, and the like, but it matters fundamentally in disaster response and resilience.
And And I know there's certainly a lot of lessons to be learned about the ways in which individuals and organizations create networks and connections in communities to rise above the crisis, as you mentioned, some crises. I'm also excited about an example you have of a local community that's addressing civic and social health in impactful ways. Please share.
Yeah, I'm happy to. So, actually, now a decade ago, the city of Santa Monica was really taking a new orientation to how they thought about the role of local government. Local government was important in terms of attending to the economic and social well-being of community members and making sure that permits were filled and potholes were filled as well. But they said, look, city government is not just about that. It really should be trying to advance the well-being of its community residents and helping people to thrive and flourish. So via a award from the Bloomberg Philanthropies Mayor Innovation Challenge, as well as investments from the city itself, we embarked on an effort to help them actually redefine the role of community to improve well-being. And the effort really was focused on not only measuring community well-being, but how to think about civic engagement and civic participation. And I just wanted to provide a snapshot of one of the findings from the work, because I think it speaks to what's galvanizing a lot of communities today that themselves have their own well-being efforts. Santa Monica really prided itself in terms of its civic engagement, people getting involved in city council, and that's all very true. But when they actually asked residents whether they felt that they could count on their neighbors, a very key indicator of neighborhood relationships and social connection, they actually found that they were falling short. And so what this suggested to Santa Monica was two things. One is they should be asking the question, and now more and more communities are asking the question about social connection, neighborhood relationships, but they also felt that they should do something about it. And they use this as a springboard to think about social connection, civic engagement, and civic participation in the context of their local policies and strategies. So on the next slide, there are some examples of how Santa Monica did this. They actually built civic engagement in the measurement and action in their city policies. So it ended up showing up in their city budgets, in their state of the mayor addresses, and things like their community plans for downtown revitalization, their integration with environmental sustainability plans, as well as their health and other well-being strategies. It became kind of the horizontal connective tissue, if you will, of how communities advance well-being. Santa Monica continues through its nonprofit organization, Civic Wellbeing Partners, but other communities, many around the country, are now advancing well-being efforts, and social connection and civic engagement are really central to these conversations.
That's amazing and very inspiring. Thank you, Anita, for adding that to our conversation. Example of how strategies actually play out in communities are really both instructional and inspirational. I'm going to welcome Michael back to guide us forward in talking about ways our audience members can find or develop strategies that will fit in their own community needs and context. Welcome back, Michael. I am so excited for our audience to learn more about CHRNR's What Works for Health as a tool. I've been a fan of What Works for Health pretty much since it's been available for so many reasons. So please introduce for those who aren't familiar with it and some of the new features that you've added recently.
Yeah, absolutely. So What Works for Health is an online database that's easy to use where you can find policies, programs, and systems changes that affect what we know makes communities healthier places. So this is a database with over 400 policies and programs that have been reviewed by our analysts that have reviewed the underlying evidence and then have ultimately assigned an evidence rating demonstrating how effective they are and summarizing that evidence for you all. One of the pieces that we've also introduced to What Works for Health is a disparity rating and an equity analysis to really lift up the underlying evidence to support how effective could this strategy potentially be to decrease health disparities. One important thing to note is that we are constantly updating What Works for Health. And so just even over the last couple of years, we've added several strategies to the database related to civic health. And I saw some chatter in the comments in the Q&A about how do we take action? And I think Anita shared some really powerful examples of ways that communities have taken action. And this is another place to go for kind of inspiration and to really understand what's possible. So over the last couple of years, we've added, this is just a sampling of some of the strategies included. We've added strategies that are really important to creating those socially connected communities. So this includes things like public libraries and processes like public deliberations and participatory budgeting. It also includes things like voter registration and voter turnout initiatives. Last year, we also added a youth civics education strategy to the database. So like I mentioned earlier, we've summarized the evidence for each of these solutions. We've offered implementation examples, which is something that we hear a lot as something that's really valuable for practitioners to continue to learn from. And I'm going to walk through a couple just a little bit more in depth to give you a sense of what's included.
Great.
So I'm going to start with public libraries. And I think public libraries is one that's important to highlight here because so many of us are familiar with public libraries. And it's really important for us all to think about the role that libraries play in helping create safe places where people can gather for activities, programs, classes, and more. So our underlying kind of analysis of the evidence suggests that this strategy would be rated expert opinion, which means that public libraries are recommended by experts to increase community involvement and to increase social capital. When we're thinking about equity or disparities, we've assigned the strategy a rating of potential to decrease disparities, and we've rated it because of it has the potential to decrease disparities around access to resources, to services, and to public spaces for community involvement. And what's important here is that it's effective. There's evidence demonstrating that it can be effective to decrease disparities, particularly for residents who with low incomes, the youth, older adults, rural residents, and other vulnerable populations like refugees.
I'm really glad you called out libraries as far as being part of the solution, because really that field, that sector has changed a lot in terms of its role and what it can do beyond books. Books are great, but they do so much more in communities.
Absolutely. And I think libraries are just, they play a really important role as we think about our civic infrastructure. And it's something that most of us have access to within our communities. So it's a
Yes,
really kind of important way to think about how can we continue to support and nurture kind of this space.
absolutely.
Another strategy that I wanted to talk through really quickly today is a process, and it's called public deliberations. And this might be somewhat of a new concept to folks, but I think the process in and of itself is going to sound probably familiar. So public deliberations is one of many names for facilitated and informed conversations between community members. What's important about these conversations is that they're structured conversations around a specific topic, and they usually include people with a range of values and beliefs and perspectives. So these are spaces where people come together to really surface the difference in perspectives, ground themselves in a shared understanding of evidence, and try to identify potential solutions. So our analysis of the evidence supporting this strategy landed at an evidence rating of some evidence, which means that there is emerging evidence that shows that public deliberations can lead to, this is important, reduced polarization and stronger issue knowledge for those who participate. And it's rated potential to decrease disparities in those areas.
Great. I just want to pause and ask, when I hear public deliberations, I might think primarily about governmental processes, things like town halls, but are there actually non-governmental opportunities where you see public deliberations being effective?
Definitely. There's a lot of nonprofit or kind of community-based examples that are featured in the implementation examples of this strategy. And oftentimes these are spaces that are set up by kind of a nonprofit organization where they've been really intentional about bringing people together with different views and perspectives around an issue that matters, that people care about, and really kind of facilitating conversation to surface differing perspectives, to deepen understanding of why people are thinking the way that they might be thinking, and then to kind of work towards solutions.
Wonderful.
All right, well, I just walked through 2 examples of the 400 plus strategies in What Works for Health, and there's a lot more information. I gave you the very Cliff Notes version of each of those. I've mentioned that we've added several new strategies to What Works for Health, focused on civic health. And I wanted to highlight that we've also curated a list of strategies. So there's about 44 strategies that we flagged as being important, both to nurture civic infrastructure and participation within communities, this could be a good starting place. So if you are thinking today or inspired by today's webinar and thinking about what actions can I take within my community, or you're thinking about what strategies could we kind of refine within our community, this is one place to get started. And with that, I'm going to pass it back to you, Joanne.
Thank you. It's a great place to get started. And Michael has just kind of given a very effective teaser to encourage all of you to go to What Works for Health. And Anita also dig more into the research that Rand has done to really kind of identify again some of these intersectionalities and how people's mindsets really are influencing civic participation and civic health and social connection. So I just want to thank you both, Michael and Anita, for sharing the wealth of knowledge to help us better understand how civic and social health are connected, and also to inspire us by potential solutions to try in our own communities. So folks, remember that we will have Michael and Anita joining us in the discussion group. So hope that many of you can join us there to continue the conversation. But right now, I'm going to hand it over to Riso. So because we have time to field some of the questions that you've been posting in the Q&A box.
Thanks, Joanne, and thank you, Michael and Anita. This has been amazing. And in case you haven't seen it, lots of love in the chat box for all the things that you're sharing. Hopefully you'll get a chance to see that soon. I do want to let participants know that we have a lot of questions and we may not get to all of them in this Q&A section that is a little bit shorter, but please stay with us again for the discussion group immediately after. Some of these questions are going to be good for posing to the whole group for some suggestions on how people are doing things, and others clearly for you, Anita and Michael. So looking forward to a little bit of time here. The first question that was asked had to do with how one might find out the policies in their town that exist that could impact social determinants of health, and specifically civic engagement and social connection. So any recommendations or suggestions for how one might go about finding? They can only find housing policies. They're wanting to really look at a bigger subset. So any thoughts about that?
I don't know if Michael wanted to share. I mean, usually kind of public laws and ordinances are available either through links from city or county websites or databases. They're not always as organized as one would like to look cross-sectorally. So that is a challenge in terms of kind of connecting the dots. Some of these are contained in department websites often, and different states sometimes have county-specific policy descriptions as well. So states that have policy institutes like Georgia Policy Institute or some of the other policy institutes sometimes catalog some of the big ones with respect to kind of the social drivers of health. In terms of civic participation, there are people who are tracking nationally, particularly laws and policies and ordinances that are seeking to make it more difficult to civically engage. So there are groups looking at things like the cost of voting index, which is looking more at the voter suppression side of the equation, and they're mapping those kinds of things. That's actually out of a group from Northern Illinois University. And there are other examples of groups specifically looking at the voting piece of this. But in terms of the kind of the civic participation as it intersects with social drivers of health, that's a little bit more challenging. National League of Cities has some policy databases that are particularly useful to look at that might give you a window into some of this. And they're actually looking to potentially maybe create a database on policies that would promote well-being, which would include civic engagement. I don't know that they're far along with that conversation, but they do have some through their metro and more local kind of policy part of National League of Cities. So those are just a couple examples from my end, and certainly Michael may have others.
I think that was great, Anita. I think the one piece that I would add is really just to approach this with curiosity. So ask lots of why questions. I think you can do the searching online for policies, both at the local, state, and national level that are shaping civic participation or infrastructure in your community, but you also have elected officials. And so it's like email your elected officials and ask about policies that might be on the books in your community that's relevant to a topic that you're interested in. And that can also be a good starting place. So you can do the work online and do the digging, and like there's a relational component to this as well. And being in community with other people, whether it's contacting an elected official or working with a group that might already exist in your community, is another way to get started.
Those are great answers. Thank you very much. We have time for about one more, and then we hope everyone does join us for the discussion group, because there we can really dig into a lot more of these questions. One of the questions had to do with basically transportation. We know that that can be a barrier for people to access resources, to be civically engaged, to go to libraries. And so what have you all noticed in terms of creative solutions to help folks be civically engaged via transportation improvements or policies specifically connecting those two?
I don't know if Michael, you want to jump in?
I'll give a short version, which is that we kind of include transportation as part of our definition of infrastructure. And I think there's lots of ways to think about this. I think on the solution, and I think there's multiple ways to think about it from a solution perspective as well. So some of this does go back to like policy level decisions within communities, whether it's zoning regulations or mixed use development or support for public transportation. All of these policies or investments in these types of infrastructure is really nurtures ultimately civic participation. So we've included that in our framing. We have a few strategies in What Works for Health focused on public transportation system or incentives for public transportation system. I know there's individual level incentives around like voting, like get out rideshare programs to get people to the polls. I know there's a lot of creative local solutions. And I would just really encourage people to zoom out a little bit and really frame it as kind of a part of the broader infrastructure that shapes the opportunities that people have to participate. Anita,
Yeah, that
what
makes
would
a
you?
lot of sense.
Yeah, I would say, yeah, there have been some communities that we've had the chance to work with had explored voucher systems with public transportation for people's participation civically. They've been hard fought, but probably short lived, but there's still some creativity and innovation behind that can work. People have also done kind of volunteer banking. Some of that's been tied to high school volunteer requirements and things like that, and have done more wraparound thinking, which then includes the transportation component of that. The challenge is the robustness, as Michael rightly pointed out, of like consistently investing in that infrastructure. That's where I think communities have been more challenged. So a lot of the focus that we've had and others certainly is how do you bake these things into traditional routine processes rather than making it an initiative overlay. For those of you who obviously work in city or county or local government, those are easy to rip away. So the more that things can be tied into like routine administrative practice of particular agencies, the better. And there have been people who have attempted to try and start to do that. And that's where I think some of the thinking is now.
Thank you both, Anita and Michael. We're going to join you momentarily in the discussion group. We have a few closing slides to share with folks as we wrap up this particular part of the session. And again, we thank all of you who are on the call with us. We have a record number of participants, and we're very excited that you're all here. So we have a few things to share with you. We are very excited about our next Socially Connected Communities Network webinar and discussion group. It's called Building and Sustaining Resilient and Socially Connected Communities. We'll be joined by Erin McDonald, who leads People and Places Thriving, the Federal Plan for Long-Term Resilience, which is an initiative of the U.S. Department of Health and Human Services, Office of the Assistant Secretary, and a surprise guest as well, who will share a little bit more about how this is working on the ground. So you can register now using the link that Becky's about to put in the chat. And remember that when you plan to join us, you'll want to also mark your calendar to join the post-webinar discussion group from 4 to 5 p.m. on the same day. To stay up to date on all future webinars and other socially connected communities webinars, visit our webpage. Again, these links are going in the chat for you. And a reminder to watch your email inboxes to receive the recording, slides, and resource guide from today's webinar within the next week. You'll be the first to see it since you joined today. We're going to disseminate these materials more broadly on our website next month in June. I'm just going to cover a few more important items before we segue into the discussion group. Hang in there with us. First is a poll. It's a very quick poll for our learning and quality improvement interests. Please answer the poll question that Becky is launching now. I gained new learnings or insights by attending today's webinar session. Simple yes or no. And we appreciate you answering that question. A good majority of you are weighing in now, and pretty much 99% of the answers are yes. So thank you so much for that. And then if there are topics or issues related to your socially connected communities work that you'd like to learn more about, we'd love for you to put those in chat as well, because that will help us as we plan out for future sessions. Okay, so let's keep the momentum going around learning and engaging. Please join us now for the post-webinar discussion group. We're going to be moving to a new Zoom meeting for this session, so Becky will chat out the link for you all in a moment. We hope you'll join us, as this is another opportunity to continue to go deeper in this conversation with each other and with our presenters, Michael and Anita. So it's also an opportunity for you to do some networking with others across the country and in other countries doing this work. So we hope you will join us. That link should be in the, yep, it's in the chat now. So we invite you to sign off and go ahead and click onto the webinar link, and I will see you over there shortly. Thank you so much. Please stay connected and up to date with these QR codes that will take you to our LinkedIn page, sign you up for our newsletter, be on the YouTube channel where we put all of our recordings. And we appreciate you all very much and the work you're doing in your communities. Take care, and we'll see you momentarily in the discussion group.